years ago, I had a partially torn ACL. We actually didn't do any surgery, just rehabbed it, and knees were fine for quite a while. But then whenever I would engage in, physical activity, specifically skiing, would kind of aggravate them. I'd get over the days of skiing, they'd get increasingly stiff and achy, more filling. And this had probably been going on for at least 5 years when I do ski trips, ski multiple days at a time. And it was every time getting a little bit more severe. A couple of years ago, I'd read Dr. Kelsey's book, and for whatever reason, I wasn't in a position where it hurt enough to act. But a recent ski trip last spring in I think April of 2022, I kind of came to the realization that I probably ought to try and do something if I wanted to continue skiing, because my knees were just at this point, it was getting pretty obvious that my time was limited. And I remembered that Dr. Kelsey's book said there is a way, to rehab the cartilage, improve the knee health, and as opposed to just waiting for a knee replacement. So I grabbed that book and kind of read through it. And after reading the book and seeing all the exercises, it was pretty clear it would be very helpful to get some guidance. Working with Lori, you have a great toolbox. You have a wealth of knowledge, a lot of exercises. Whereas every other physical therapist I'd worked with, it was pretty cut and dried, and not a lot of good knowledge about knees or how to rehab them. In fact, they probably didn't even think you could. I don't have to drive a half hour, an hour to a physical therapist each way, et cetera. So it's been real easy to integrate this into daily life. Definitely. I learned that this consistent, steady work is what takes to yield benefits with my knees and to improve them. And, one of the big thing I learned that, it is possible to improve my knee health and not just wait for a knee replacement, which I've seen so many friends go through over the years. Their mobility decreases, their activity decreases, and they just kind of, put up with the pain until it's too severe, and then they go and get a knee replacement, and they've lost, 5 years of good activity. And it looks like in hindsight, for some of them, it probably wasn't necessary. I had my ups and downs physically. We exposed some weaknesses in my fitness, and caused some pains here and there. But then in the end, it all kind of came together. Like I said, the skiing trip in last spring led me to Lori. So then the goal then became, let's, work on my knees, get in the program, follow that. And then I'll go skiing again in December, and that'll be kind of the acid test. And I did, and just a couple weeks ago, and skied 3 days in a row, moderately. I didn't want to really hit it too hard, but my knees didn't feel a thing. It was like the day after 3 days of skiing, it was like I woke up in the morning and it would have just been a regular day, with absolutely no after effects at all. And that's pretty astounding from what my past history has been. So that I can talk for more on that, but I think that says it all right there. It's been a huge success for me.